Hey future doctors, welcome to Pocket Mbbs, where medicine fits in your pockets. Now let's study. Today's topic is endometriosis. Endometriosis is the presence of endometrial tissue outside the uterus along with stroma and hemosiderin present outside the uterus within it. It results in bleeding in that area too during the menstrual cycle. The common sites in which endometrious tissue is found are ovary, in which it is called chocolate cyst because due to collection of old blood, broad ligament, pouch of Douglas, intestine, lungs, and pelvic peritoneum. Now, the clinical features of endometriosis are pelvic pain and infertility. Now, there are some theories which will explain why the endometrium is present in the different regions. The most popular theory is retrograde menstrual theory, in which it is the most widely accepted, in which retrograde menstruation through fallopian tube leads to diffuse seeding of endometrial tissue, in which endometrial tissue deposited outside the uterus and endometriosis happen. It means that the menstruation occurs in backward direction from uterus towards the ovary via fallopian tube, which leads to accumulation of blood in the ovary that leads to the formation of chocolate cyst or endometriosis in the ovary. Second theory is benign metastatic theory. This theory was given because the retrograde menstruation theory does not explain the origin of endometrial tissue in lung, pelvic peritoneum, and other parts. In benign metastatic theory, endometrial tissue is spread from uterus to distant sites, example bone, lung, and brain, via blood vessels and lymphatic channels. Now, the third theory is metaplastic theory, in which endometrium arises directly from metaplasia of coelomic epithelium. Now, the molecular changes of endometric tissue differs from normal endometrium by exhibiting marked activation of inflammation, in which there is prostaglandin production and increased stromal aromatase activity via estrogen production. Now, grossly, nodules with a red, blue to yellow brown appearance is seen, and in microscopy both endometrial glands and stroma appear with or without the presence of hemosiderin laden macrophages at ectopic sites. Now we will study chocolate cyst. Chocolate cyst is endometric lesions bleed periodically in convert ovary into a large cystic mass filled with brown fluid resulting from previous hemorrhage that convert into chocolate cyst due to its brown color. It means that menstruation takes place inside the ovary, which leads to the accumulation of blood in ovary, which on the period of time become old brown in color and appears as a chocolate, so it is called as chocolate cyst. Now, the clinical features of chocolate cyst are dysmenorrhea, severe pain during menstruation, dyspareunia, pain during sexual intercourse, and infertility. It is also called a clinical triad. Now, the risk factors for endometriosis are endometriosis is a precursor to the carcinoma, endometrioid and clear cell carcinoma. Now, adenomyosis. Adenomyosis is the presence of endometrial tissue into and between the smooth muscle fascicles of underlying myometrium. Clinical features of adenomyosis are no cyclic bleeding, menorrhagia, irregular or heavy menses, colicky dysmenorrhea, dyspareunia, pelvic pain during premenstrual period. Now, gross features of adenomyosis is uterus is mild to moderate enlarged, and cut sections show coarse trabeculations with ill-defined areas of hemorrhage. Microscopy reveals irregular nest of benign endometrial glands and stroma deep within the myometrium. Minimum distance between basal endometrium and endometrial tissue of adenomyosis at least 2 cm. Adenomyosis means the formation of endometrial tissue into the myometrium. It is due to the transfer of endometrial glands and stroma into the myometrium, which is 2 to 3 cm deep. Distance from endometrium to myometrium is 2 to 3 cm. Now there is irregular bleeding takes place, which leads to many complications. Now, the tumors of myometrium are leiomyoma. The middle layer of uterus myoma tumors are leiomyoma. It is a benign tumor. It is the most common uterine tumor of smooth muscle origin. It is also known as fibroids. It is common between 15 to 45 years old female, and its etiologies are genetic mutation like MED12 gene mutation, rearrangement of chromosome number 12 and 6. There are three types of fibroids: submucosal, maximum risk of bleeding underneath endometrium; subserosal, beneath the serosa; and intramural, within the myometrium. Gross features of leiomyoma are great white homogeneous mass arranged in rolling pattern, well circumscribed and capsulated, firm and nodular. Microscopic features are rolling pattern seen, intersecting fascicle seen, cigar-shaped nuclei present, and no mitosis is seen. Clinical features of leiomyoma are usually asymptomatic, abnormal bleeding, urinary frequency increases, infertility, and malignant transformation into leiomyosarcoma. Now there are degeneration of fibroids: hyaline degeneration, calcific degeneration, and red degeneration. Hyaline degeneration is pink pigment seen, and in red degeneration it is beefy red along with pregnant women. Means the female having leiomyoma show beefy red appearance of the fibroid in their pregnancy. Its features are fever and abdominal pain, and on investigation there is increased WBC and increased ESR count. Now the variants of leiomyoma are cellular leiomyoma, in which there is increased number of cells, and symplastic leioma, where is atypia present. Now leiomyosarcoma features are atypia with mitosis, necrosis, and cellularity. It is malignant in nature. Histology of leiomyoma: it is the benign fibroblast, benign smooth muscle and rolled pattern is seen, and hyaline change is also seen. That's all for today's videos. Thank you. Follow for more such videos. Do like, share and subscribe to my channel.